No, thank you. Thank you, Suki. Okay, well, thank you for staying on. I know this is your evening, and I don't know if many people have had a presentation on health and well-being. I'm definitely seeing a trend in health and well-being. It was on my appraisal about a year ago to look into the Wellbeing standard, because it was the new kid on the block as far as a certification. But I don't want this presentation to be about the Wellbeing standard. I want it more to be around us as engineers and what we can do in our lives to make our buildings healthy, because I don't think any of us go out to make them unhealthy. There has been a lot of publications on health and well-being coming out of the last few years, I guess. I know that the BCO for offices standards, the good practice guides, are looking at having a chapter on health and well-being in their next slides. But these are just a few, flavour of a few for homes, health and well-being in homes by the UK Green Building Council, a publication released last year. You've got the retail sector and how people can enjoy shopping more, and the experience of shopping more came out again by the World Green Building Council. There are other papers as well apart from just these three. I mean, this one is a bit old now. This was October 2014, and it was a paper done to try and find out the cost of a green building and what does a green building really mean. And they had various metrics that was in there and various surveys and various analysis, and the outcomes were, there was quite a few hot topics in there on the health and well-being. So they didn't really get to a financial cost, but they did come out with some numbers about if you get the air right. I'm a mechanical engineer, I should say, I suppose, deep down in for many years, but I've been living, breathing sustainability and everything around EPCs, DECs and acronyms, BREEAM, LEED, Green Star, all of those acronyms of sustainability. But health and well-being has been a large part of my life. So if we get the air right, we can get productivity, increase productivity, decrease absenteeism. If we can get the temperature right, although we'll never please everybody with temperature, but if we can get the temperature right, then again that will have an impact on performance. And if you can get the light exposure to people, then they're going to sleep better. They're going to have 46 minutes more sleep. I don't know how they worked out you get 46 minutes more sleep from having the right light, but what that really is, my understanding is, it's more to do with the quality of sleep that we're getting. If you're exposed to the right level of light during your waking day, then you'll have the right chemicals released in your brain, cortisol, melatonin, and then that'll help you improve your sleep at night time. I've changed a few lights in my house since reading up on all this stuff, so I've got nice yellowy lights rather than the stark white lights. And even tonight in London, there's a bit of a gathering going on where back in October last year, 11 teams participated or started their participation in health and well-being in their workplaces and monitoring the health and well-being in their workplaces. And then monthly they're looking to feedback and see how they can actually improve that. So again, this is all just another illustration of what's going on around health and well-being. It's not just the Wellbeing standard that came out almost 2 years ago. There is a whole plethora of research, investigations about our internal environments. I don't think people are bored of sustainability or fed up with the word sustainability or environments, but it's just a shift of focus now, and maybe it's the next interesting thing. Yeah, so just being aware of what's going on. Hands up if you have heard about the Wellbeing standard prior to this evening. I'm just intrigued to see if it's getting momentum, because it has been around a while, so that's quite a significant portion of us. For those that have no knowledge of the Wellbeing standard, I guess it came out in October 2014 as a standard where you can certify the internal environment of your building. And it was based on 7 years of research between both the medical side as well as the built environment professionals. So doctors speaking to engineers, which must have been an interesting one. And it's about everything that we do in building services and how not just the building services side of it, but the stress and the mental health and the well-being, and how they can be influence things. So the Wellbeing standard followed the same kind of path as LEED. It did come over from America. It means that you can get a silver, gold, platinum rated environment or building or shell and core fit out. And the manual's out for commercial workplaces, but there's pilots in retail sectors, education sectors, and other homes sectors. And the manuals broke down into 7 sections: air, water, food, light, comfort, fitness, mind. And we Cundall, when we fitted out our London offices by St Paul's Cathedral, got the first WELL Gold certified environment in Europe. And there's quite a few people within the business that are WELL APs. I'm a WELL AP, which means I've read the manual and passed the test. We looked at BREEAM, we got BREEAM Excellent for the fit out, and we've done SCAR as well. And we just wanted to know a bit more about it. It's not to say that we're brilliant by any means, but it's just to, through our experience, I can actually share what that meant to us in reality in trying to deliver a WELL Gold certified building if you want to get that for your clients. Because it was a bit of a learning curve. So why are we seeing health and well-being as, well, from my viewpoint recently, quite an important issue? And it comes back to this, okay, we spend a lot of our time indoors. We've been in this room for a few hours now. And we, in our cars, in our homes, in our workplaces. And we know, a publication came out from the Office of National Statistics in 2013 that said there's 131 million work days lost due to sickness. And that's in the UK. And that's, sometimes when I see these statistics, I think, well, what does it actually mean? It means, on average, in your workplace, imagine somebody being off sick on average 4.4 days. That's what it means. 20 years before that, it was 178 million, so environments are actually getting better, so we're doing quite well, we've kind of reduced that. And the illustrations are just the three contenders, the 3 main contenders. You've got colds, you've got musculoskeletal, and then you've got stress. The highest one is the musculoskeletal. This is the backaches. And that's quite a large portion of those lost working days. So as engineers, we're not designing the desk so much, but the desk technology, sit, stand, being able to stand, and we're seeing that in our workplaces now, having the screens being able to angle, things like that. The other 2 are less. I mean, colds, you would have thought colds would probably be one of the highest, but stress is creeping up now. And that mental health and that mental well-being is a large proportion of those lost sick days. There was some further statistics in that about where you are in the regional, whether you're working for a private company or a public company. Public companies slightly more, private companies less. If it's working for the NHS, then you've got more lost days to sickness. Working for the North East, Wales, and I can't remember the other place, but that was also a higher number. So in the news, there are articles that you see, I see them quite frequently now because I'm more switched on to when things come up, but 40,000 deaths, premature deaths due to air quality. And there's a map there that says the particulate levels, the 2.5s, the dust levels around the country. Not surprisingly, in the bigger cities, then you've got a higher rate of an early death, 8.3%. There is some small print down there that says that this data, by the way, could be 1/6 to double the percentage shown, which is quite a big broad spectrum. But it's I don't know, it is becoming more and more. Even the West Midlands, there was talk fairly recently in the newspapers about air pollution and living in a city centre, but then living closer to cars. But is it cars? I mean, cars give out emissions, but you've also got the dirt levels. This graph is London, and the bar is the World Health Organization level for PM 2.5 to be a nice environment. The black line is the internal air quality sensors in our office in St Paul's, and the blue line is outside. So you can see the internal tracks outside a bit. The grey bars are actually working days. And there was a case on the 22nd of January this year when 24 boroughs of London recorded a level 10 air quality. That's the highest kind of red alarm bells. That means if you're elderly or upper respiratory sufferers or asthmatic, then you need to be not going outside or taking vigorous exercise. You should be a bit careful. And it was on a Sunday when they recorded this highest, the blue bar there is on the 22nd of January. It's a Sunday, so it's not like there's a lot of car traffic going on in London. It was a still cold day and the weather conditions were poor and the particulate levels rose across the whole borough. One of the contributors, they believe, might be to do with wood burning stoves being more, it's cold, so people have got their wood burning stoves going away and they release lots of emissions. But what we can see in the office, the black line, is our our air quality is pretty good, and that's because it's positively pressurised, it's got the ventilation plant coming on. And when the office vent turns off, the wind-borne kind of affects the leakiness of the building, means that it starts creeping up during the white bars. That's when the office internal environment getting poured in. As soon as the plant kicks on, it brings it back down into a good level. And that's just filtration. That's just making sure that you've got F7s for those mechanical engineers, or MERV 10s if you're Americans, plant kind of filtration levels. So what can we do as engineers to help the health of our buildings? It's not just the engineers, it's the architects, it's the FM teams, it's the landlord. Everybody needs to work together for this well. And I kind of talked about some of those. So on the air side, I've highlighted in blue what us as engineers, building services engineers, could probably do. We could look at air testing. We could look at the fresh air, amount of fresh air that we pump into the buildings. VOCs, volatile organic compounds, these are the off-gassing, the nasties, the pollutants that come from the new stuff, whether it's new insulation, whether it's new carpets, new furniture and stuff like that, like creep in. So we can make sure that we're specifying materials that have low emissions. Carbon filters, you don't have to put carbon filters on, but you might allow space for carbon filters if there's a problem. It's easily retrofitted. And again, UV light to cooling coils, again, it's just that airborne mould potential. And that's some of the things that the Well Building Standard does look at. When we fitted out our London office, we were worried about the volatile organic compounds that we had to meet as a real test in order to get our badge. So we specified natural materials. We had bespoke joinery made up, which didn't cost us a lot, but we knew where the materials were coming from. The floor is a Bolon, it's a recycled plastic floor. There wasn't uplifting cost to that floor, but it's easy to maintain, it's cleaner, easily wipeable, and all the rest of it. But things to do with paints, things to do with adhesives, making sure that they're low emissions, and even the lacquers and varnishes, using beeswax or linseed oils. These are natural materials, all are a positive thing. One of the quotes there is just from the fit out, the contractor who was fitting it out. He said, okay, if I can drink the paint, I can put it on the walls. And we tested our office, and we actually failed the VOCs. We had an 8-hour test carried out, and the reason that it failed was because the landlord had been in during the test. The building was empty, and it was the cleaning products. We then retested the following week, and it was all okay. And that just goes to show again that the FM team and the materials they use to clean it is equally important as what we do as engineers in the design of a building. In fact, carpet instead of the Bolon floor would absorb the emissions from sprays, from what happens and then re-emits the following day. Water testing is exactly the same as air testing. If you test the water, you know that it's okay. When we tested the London water for the Well Building certification, we actually failed in one of the categories. And we ended up having to put in a water filter. And it's like, well, we're quite fortunate, mostly in the UK, that our water quality is pretty good. I'm having our water in the middle of Birmingham tested in about a week's time, so I'll find out more about how we do, or whether we need to fit a water filter. And there's 20 different things that you have to test the water for. Pesticides, herbicides, all sorts of inorganics and organic materials, normal things. So, but we don't test, we never test our water, we very rarely test our water supply, we just assume it's good. In the food, the food that we provide, if you have got a canteen, then you've got to make sure that it meets all sorts of kind of requirements to be more health conscious, that we are getting to, I think, slowly, but it's just enforcing that. There's going to be no trans fatty acids in the food. There's things with labelling. There's just making people aware. If you had a franchise production place where a cafe where you're going in, you've got people cooking food for you. There's limits on the amount of sugar that's going to go into the dispensers. You've got to have the vegetarian food first before the meat products. So you've got to have fruit on display. You've got to have advertising. You've got to have labels for allergies, labels for calories. It's all about that. But there are things that affect us that if we don't have a food establishment, to do with just making sure that we don't contaminate adjacent spaces. So the spout height has to be a certain length. The sink dimensions has to be a certain width. And you have to have paper towels. We've had this argument for years about what's best for the environment, paper towels or air dryers, as far as the well-being perspective. And this is a health and well-being presentation. It doesn't care so much about the energy or where the materials come from or the life cycle. It's caring about the fact that if you've got a paper towel, what the professionals are telling us is that's more hygienic, more cleaning, so you're less likely to get illnesses or you bin it, throw it away. Not, I don't know, spray it away. Having labels on the fridge that tells you what temperature the food's stored at. Things like that come into the food section. Antimicrobial surfaces are like optional credits. Lighting is a big part. We've already had the SLL kind of talk about light. Light is just so important on us as human beings. We are intended to be outdoors and we're indoors a lot these days. So having that tealy blue light in our workplace in the middle of the day will stimulate the right chemical release in the brains, which means we'll have better quality sleep for the evening. It's not about having biotunable or any light that changes colour throughout the day. It's just making sure that we've got that right, whether it's LED, fluorescent, it's the right intensity and it's the right colour. And that becomes a melanopic lux level, which in building standard requirements is at your nose level, seated at the desk, 95% of the people has to have 250 melanopic lux. Forget about the task and the work. There is a minimum lighting for the task, but I need that health light in my eye. And then that becomes, for spec offices, how do you make sure that the lights are in the right places? For fit outs, it's a bit easier. And we did have a spec office. We didn't want to spend money on changing the lights, so the lights are all over, are in a grid format. But we got a lot of the health light benefit through our windows as well as our artificial lights. Because we had the Bolon floor and because we chose grey, by luck we actually had an increased light reflectivity. Carpets are very absorptive, it doesn't reflect as much light compared to a plastic, recycled plastic tile. And then there's other elements of the well-building manual. As engineers, I don't think we will be getting too involved in putting things like this into our offices or our workplaces, or that would be hilarious. Yeah. But this is actually happening when my wife went to, she went to Copenhagen, and in the airport there was a bike where you could charge your phone, but there was also active workstations. We've tried it in our London office where we've just put a bike underneath a sit-stand desk. So if you did want to read and cycle at the same time, you can read and cycle at the same time. Will we see more of these in the future? But it is about that musculoskeletal, that is about that, sitting down is bad for you. Let's get up and move around. There is a section for comfort, and what can we do as engineers to improve the comfort? This then, light comes back into our field, I suppose, for both noise and thermal comfort, and smells, olfactory. Making sure that we've got the extracts from the kitchens and stuff like that. Making sure that the specification of the noise levels are right. Making sure that we're meeting thermal comfort standards. And comfort also goes into the accessibility design, the DDA compliance kind of things, making sure that we can cater for reception desks or kitchen areas for wheelchair users. So, sitting kills moving heels. There was a survey done by the BCO, about 1,000 people, and there was a lot more interest or want, desire by people to have the ability to both sit and stand at their workplace. I don't know if any of you guys have got these in your workplaces. We've got 9 desks, we've got about 80 staff, and they are pretty well used. They're normally left at a high level because people will go away from their desk and take stuff to them. But the survey found that the younger generation weren't as interested as the over a certain age group of generation for having the ability to sit and stand. I think that's because the younger generation haven't sat at a desk long enough yet and had the backaches kick in. You get that later in life, possibly. And then I'm a mechanical engineer by heart, talking about mind and mental well-being and beauty. My radiators that I put in buildings a long time ago were never the most attractive of things. It was always the lighting. But we know that mental well-being, having a plan for beauty, having a plan for biophilic design, having that connection with nature, and it's not just plants that we put in buildings, but it is about materials, do make us feel good. We've got plants in our offices. We put plants in the London office when they fitted it out, and one partner had his plant next to his desk, and then somebody started moving his plant away, and he says, "What are you doing with my plant?" He said, "Well, we're having a reception gathering, a bit of an office celebration. We want to move the plants into the reception area." He took ownership of that plant from day one. People like you know, there is a definite connection between us and being outdoors and having a nature connection. We've done some studies in plants. We know that plants photosynthesize. We also know that it's the soil that does the really good stuff in the plants. So although plants photosynthesize and give off some oxygen, we did do some studies. We did put a graduate volunteer to go into a room of plants and monitor the air quality for a while. We found that if the plants had got a lot of natural daylight, they gave off more oxygen. We found out that we could probably reduce the fresh air rates by 10% if you had a lot of plants in your office environment because of the oxygen given off. But we also know that the organisms in the soil acts as a filter, and that really does the actual cleansing of the air and can strip out some of these VOCs. So you get different types of plants will have different type of health benefits. They'll all want different types of light, and you do have to just play around and move it around to see. And these are all examples of plants that we have in our own offices. You can get things like this. If you go onto the internet, that's a pie wall. We put it in London. It's a water bath at the bottom. You can flick a switch and it irrigates the rest of the plants that are in pots. We put a fan behind it because we're engineers, we like tinkering. So now we're circulating room air through the plants, through the soil, and actually filtering the air. The UK Green Building Council, when we fitted out their small office environment, had a similar scenario where they wanted to bring the air in from outside. It's a polluted environment, it's the middle of London. But they had plant walls and ventilation systems built into plants walls to help distribute it. Yeah, it can be done. That's a moss board. Again, you can buy these any colour. It's in stasis. It's not dead. It's not alive. It's never going to live again. But it's very tactile. It's very vivid. You can get them in different colours. We have it in the room at the back there, but it was on the desk for a while, and people would congregate around the moss board because of this sponginess, this tactileness. Apart from him. He didn't like moss. And then there's, for the mental well-being, having places of refuge. We do still want, the survey says we want open offices, open plan offices. We don't want cellarised spaces, but we must now have these places where we can go to some refuge spaces. And we're playing with furniture, with materials to create those refuge spaces. And the cost, the well-building standard, to get that goal, didn't cost us a lot of money, is the solution. There is mandatory credits that you must meet, and a large portion of the assessment methodology is this prerequisite, these mandatory credits, but you will do a lot of this naturally. And there probably is some of our time costs around doing some of the analysis work, about doing some of the actual delivery of the project and supporting the project that go in there as well. But ultimately, it didn't cost us much. And we've got data now, so we can actually calculate what the payback is. It is a limited kind of survey. It is our own offices. There's 180-ish people, 160 to 180 people in the London office. And when people move from one workplace to another workplace, it's all shiny, it's all new. Most are happy, apart from those that have had to commute further. But there was a significant increase in the numbers of the post-occupancy, because we've been in that space now for 15, 16 months. Staff attraction, retention, productivity, all of them had a good uplift in the score. And the office before wasn't a bad place. It was air conditioned with chilled beams, and it wasn't that tired. But yeah, the new office space is a really nice, fresh feeling place. I wouldn't say it's anything beyond, to hit the well gold standard didn't mean that we had anything wacky or Google-esque or slides around the offices. It's just a nice environment. We can see there on the blue line that the staff retention number, the staff numbers have stayed pretty constant, but we have had this reduction in work days lost, which is great. And that means that you can actually then calculate the financial benefits, and it meant that it paid back in months. We then also compared it though to a couple of other offices that we fitted out. It's a nice fit out, but we didn't go for the well badge to see if there was any kind of difference between the two. And there was there was a definite benefit to the London office, to the other fit outs. But it's limited, whole people. It's not, we haven't got vast amounts of data on that. I've got the closing slide, and it's just really, there's about 3 more slides. This has been about health and well-being, but we shouldn't forget about sustainability. Health and well-being, a bit like BREEAM, you get contradictions in different areas. If you tick the boxes in one section, you might penalise the energy section. This happens as well. If you increase the air, you get a bonus credit in well, because you're providing more fresh air. But fan power laws, cubic laws, you can then pay the penalty through energy. So it's about making sure that it's appropriate. I've already mentioned that, you know, if you put in more filters, you could potentially increase the fan power, more energy hungry, more pollution, so you could have a bad scenario as far as that. Sticking plants in, you could reduce your air volumes. You could actually then reduce the power consumption at the power plants and reduce the pollution. So the solution is, and that's my last slide, it's plants. You need some more plants. Thank you. If there is any questions, or if you do want to go home, I do appreciate it is late. Please do come up and ask us anytime, or get my details, and yeah, contact me. Thank you.
Thank you, Paul. Very interesting. I'm definitely going to be speaking to you about this in the near future, because this is one of the areas that I've always been talking about in terms of engineering. It's not always the best solution to put more technology in. Sometimes we need to go back to nature. Nature has the answers. It does look after itself. So, thank you for that. And just to wrap up for this evening, thank you everybody for attending our AGM.